Question to ER providers, what is your PTO like? I did emergency medicine for 15 years, never had any PTO whatsoever. No formal PTO, zero PTO. Was offered 2 positions in the last 6 months, neither had PTO or sick time. Could you imagine if you are super sick, you are in the ER, and that individual who is about to throw a breathing tube down your throat is running on day 9 out of 10 because they have a vacation to Aruba planned. What's up, guys? My name is John and I'm an emergency medicine physician assistant. And the topic of today's video is PTO, paid time off. And I, for the longest time, have never had PTO just until this current job. And I was certainly sipping on the Kool-Aid until recently, oh, it's okay. I don't need PTO. I could still schedule my vacations. It's all right. It's a minor inconvenience. How much PTO one has in the emergency department is wholly dependent on their employer and also what state they work in. Some states have more favorable labor laws than others. For every 2 people saying they have no PTO and how they perform mental gymnastics as to why that's okay, there's a handful explaining that they have this benefit, and I personally think that that is fantastic. Dr. Majestic shares, what does the schedule of an emergency physician look like? Dr. Majestic has a pretty cool ring to it. What if I rebranded myself to PA Majestic? It's no problem having no PTO because you can just put your appointments on your days off. You can also just stack your shifts together, clump your shifts together, and go on a vacation whenever you want. However, we're also talking about the fact that you are going on vacation and you're not being paid for it. Some people, they're like, that makes sense. If you're not seeing people, you're not earning money. Thus, you should not be deserving of a paycheck. It also just runs contrary to every single full-time employee who has paid time off. They go on vacation, they're not actively working for the company, and yet somehow they're entitled to a benefit of being able to go on vacation and having that vacation paid for. When I went on vacation to France last year with my girlfriend, we already had expenses such as airfare, hotels, a rental car, food. To go on vacation and you're going to spend money and then subsequently you're not getting paid. I had all of 4 shifts on my paycheck. Since we were in France, the country of 4 or 5 weeks of paid vacation, everyone takes the whole month of August off. A lot of people, including my family, were asking, why such a short visit? Why can't you guys stay longer? Why, don't you want to stay longer? Certainly 10 days, 14 days would have been ideal. It was a good trip. Definitely could have used more time. Definitely will be going back. At the end of the day, you have to have some sort of balance between going on vacation and paying for your bills. If you guys think that PAs, doctors, NPs in the emergency department should be getting PTO, hit that like button down below. Helps the channel out so much. Really helps us get seen by more people on YouTube. Thank you. Now, with my current job, I will get 3 weeks of PTO, sick days, and I will get time and a half as special holidays. So if you work in and around those holidays, you're getting time and a half for the inconvenience. And all of this together is a benefit of about $15,000, guys. So I'm trying to speak up for those of you in EM who still don't have PTO. We need to all advocate for one another because at the end of the day, we're all the ones that are going into work, seeing the patients and putting in the time. But hold up, John. Hold on, John. John, wait, hold on. Who's going to pay for all this PTO? It's great. Money just grows on trees. I'm sure the employers are going to be ecstatic to give you guys all this free money. And I agree, it seems a little naive. It seems a little out of touch. These hospitals and staffing groups are plenty profitable. Not to mention that a lot of the other staff, from the nursing staff to all the ancillary staff and allied health, somehow all manage to get paid time off, and yet the docs and PAs have to be some sort of martyr on this front and not receive this sort of benefit. Ask yourself, who benefits the most when doctors, PAs, and NPs get no PTO in the emergency room? I can assure you it is not said staff. It's benefiting the staffing group, it's benefiting the hospital system, and it's benefiting the CEOs. The same CEOs who likely don't clock in and out for work, and they get to enjoy their 4 to 6 weeks of PTO every single year or more, who knows? Those people, the ones who aren't working the holidays, aren't working overnight. Meanwhile, we're staffing the emergency department 24/7, 365 days a year. Giving an ER physician 2 weeks of PTO is an additional benefit likely to be worth more than $20,000. And while it is a common theme to move around your shifts, while it is a common theme to only work 10 days, 12 days, 14 days in the emergency department and be considered full-time. And I think that is great. We deserve PTO. You should still be able to get paid. If you want to go on a vacation, you should still have some money coming in. Guys, what are these health systems? Where are these hospitals that are giving you paid time off in the emergency department? Leave a comment down below. It will help out your colleagues when they're looking for jobs and they want to focus on these sorts of benefits. I was also just trying to figure out if this is a systemic issue or if this is just a problem in my area. I tried looking up ACEP's position on PTO for ER physicians and I did not find anything. So I'm not even sure if the American College of Emergency Physicians has a statement on PTO. ER physicians, people who go and slave away at the books for many, many, many years, who are selfless, who give a lot of their time, energy, and emotional well-being to a profession, and yet that same profession is not trying to take care of them by giving them some extra money to go on vacation and to have some time off and to go enjoy life with their families. I am very interested in what you guys think about this subject. If you think it is just, if you think it is unjust, if you think I'm stupid and just talking out of my ass, let me know in the comments down below. It is completely free to comment. I do read the comments. Thank you guys so much for watching. Stay safe out there. Have a great rest of your day. Bye-bye.